Okay, this is my final presentation for writing in psychology, substance abuse. Substance abuse is a mental disorder that is very complex and causes clinical disturbance and dysfunction in one's life. When regarding substances, we're talking about stimulants, depressants, psychedelics, and also legal ones such as alcohol and tobacco. It affects all kinds of people and their quality of life, regardless of age or demographics. But college students specifically are susceptible, and mainly those between 18 to 25 years old. Substance abuse is more prevalent in college students than expected and can adversely affect their general motivation, academic performances, romantic relationships, and physical health. We found that general motivation deteriorates when different substances are involved. Risky alcohol, cannabis, and sedative use were all directly correlated with students' dropout rates, especially if they didn't have good self-efficacy. Another study then agreed that low self-efficacy and positive attitudes towards stimulants were associated with more likely stimulant use. Overall, it demonstrated how students that engage in drug and alcohol usage had more of a tendency to experience a lack of inspiration or motivation. College students' academic performances were also negatively influenced. Quality of life scores were reported lower in users than non-users, and another study added that alcohol use disorder and cannabis use disorder were positively correlated with academic decline over 4 years. Collectively, both research findings supported how 3 separate drugs all had the same problematic effect on school grades. A smaller study then admitted how codeine abuse worsened. A smaller study had students admit how codeine abuse worsened their academic performances. Altogether, the 3 studies showed that 4 substances, stimulants, opioids, cannabis, and alcohol, all had negative effects on students' achievement in college. Romantic relationships are also poorly impacted when substance abuse is involved. In an intimate partner violence study, analgesics and benzos, along with cocaine, enabled perpetrators more likely to abuse. Considering the information, we see how those who use stimulants in relationships are more likely to be violent and destructive towards partners. Another study added that 70 patients reported tobacco use, 17 with alcohol. So we see how tobacco is far more common than anticipated, and that legal substances such as alcohol and tobacco can also influence romance. Although about half of these patients reported partner violence studies in questionnaires, only 7 of them disclosed it when consulting with providers. This displays that when substances and violence are involved, partners are more susceptible to damaging each other physically and also being dishonest. Substance abuse also sometimes affects physical traits. There were associations between self-reported anxiety and impulsivity with increased cannabis and alcohol use and lower exercise intensity levels. This shows that users who consumed more drugs worked out less intense and less often. So it's visible how substance abuse can hinder physicality and create drastic effects on students' physical health. Consequently, high anxiety sensitivity also displayed that those who self-report have inaccurate beliefs about their physical abilities. Apart from those basic effects, being involved in sports can also impact college students and their relationship with drugs. It inflicts substantial amount of pain, and in a large questionnaire, we explored non-medical use of prescription opioids with athlete status, injury history, and the amount that they used opioids. The findings showed that participation in varsity athletics was correlated with a higher possibility of injury, and also the odds of sustained injury and using non-medical opioids was 2 times greater. Those who participated in sports had harmed their athletic abilities they were more susceptible to opioid usage and more likely to injure themselves. There's also a correlative relationship between pain and alcohol and cannabis use. We found that student athletes experienced more substance-related consequences compared to non-athletes, and therefore they were more likely to develop chronic pain. There was a direct effect between this pain and alcohol-related consequences as well, as both were positively correlated with pain catastrophizing. Ultimately, student athletes experienced more pain and had more substance and alcohol-related consequences than non-athletes. To counter, some studies implied that certain treatments can be explored instead, and they were not as impactful as anticipated. In the partner violence study, providers conceded on one encounter of the 98 that substance abuse and violence was a problem, so the 97 others were not considered to be affected. They also said knowledge about IPV may be enough to prevent. Another study added that possible therapeutic techniques can help. Self-awareness and cognitive behavioral approaches were advocated for. A third study agreed that introducing cognitive behavioral therapy techniques can help with physical activity and rewards of exercise. By implementing institutional interventions, a last fourth study said this can help with academic performance as well. Regardless, there are not enough techniques that effectively treat everybody who has substance abuse disorder, and too many numbers and results prove otherwise. Overall, we see how substance abuse is a pervasive global crisis, has numerous consequences on college individuals, and how their academic outcomes, romantic endeavors, physical health, and sport talents are affected. But with more awareness, comprehension, research, and mental psychotherapy techniques, college students can avoid substance abuse disorder. And these are my references. Thank you.